Many people make New Year's resolutions, and then the question becomes, have you stuck with it? And for a lot of you, weight loss is often on that list. Whether you have 10, 50, maybe even 100 pounds to lose, St. Luke's network of care has options for you. And if you've struggled to see long-term results and have 100 pounds or more to lose, now might be the time to consider weight loss surgery. Dr. Matthew Ricks is a bariatric surgeon with MyNewSelf at St. Luke's Hospital, and he's here to talk about some common misconceptions about weight loss surgery. Thanks for being here.
You bet.
And I think there are a lot of misconceptions about it, and I want to get into a few of them. And I want to start with this misconception that this is the easy way out. Oh, the diets didn't work for her, and she's too lazy to really do the work, so they're just going to have the surgery. And that's not the case at all.
That's not the case at all. You know, people who come to us for bariatric surgery have been through multiple attempts at losing weight. They've been successful. Some of them lost even 100 pounds on weight loss. The problem becomes is once they stop whatever program they're in, all the weight tends to come back, and then it becomes a vicious cycle of gaining and losing and gaining and losing. And bariatric surgery is really the one step in helping them maintain that weight loss.
There are a lot of different ways and different options to lose weight, especially when you're talking about losing a lot of weight like we are here. But a lot of people think of bariatric surgery as like the last resort, and that's not necessarily the case either.
Absolutely not. In fact, in my opinion, it's one of the first resorts. You know, people who have gone through and have had weight loss and have done well and regained the weight, it's an actual great way to get in. The problem with weight is as weight increases, so is the likelihood of developing comorbidities like high blood pressure and diabetes, and all these tend to increase as patients gain weight.
Especially if they've been carrying that weight for a long time and into their middle ages. And
absolutely.
Such beyond that.
Yep.
And a lot of people think that it's only for cosmetic reasons, and as we just said, that's not the case.
No, that's not the case at all. In fact, a lot of times patients who have bariatric surgery and have diabetes and high blood pressure, about 90% of them resolve or have significant improvement in their diabetes where they don't need to take medications for it anymore.
Can you tell us quickly who is a good candidate for this surgery?
In general, patients who are about 100 pounds overweight. Those are really what it is, and if you have comorbidities that go along with it, it actually lowers the weight that they need to qualify.
All right, well, thank you for coming by and sharing that with us.
Thank you.
It's important stuff for a lot of folks. If you're interested in weight loss surgery or think you may be a candidate, call the MyNewSelf team. That's at St. Luke's Hospital, 314-966-9640, or you can visit stlukes-stl.com/MyNewSelf.
Calling it a life changer is probably not doing it justice. Yeah, it really is
That's right.
remarkable.
For a lot of people, it is.
Yep. Thank you, gentlemen, very much.